Hello, and welcome to CMS You. I'm your host, Christopher Semide. Each month, we here at the Centers for Medicare and Medicaid Services, or CMS, bring you the latest information and helpful tips about healthcare. CMS is the government agency that administers Medicare and oversees Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. In honor of LGBT Pride Month, which celebrates the anniversary of the gay civil rights movement of 1969, we are dedicating today's show to lesbian, gay, bisexual, and transgender, or LGBT health. Today's guests are team members from Housing Works, a non-for-profit organization based in New York City committed to ensuring that all people living with HIV and AIDS have access to quality housing, healthcare, HIV prevention information, and other life-sustaining services. The Housing Works Community Healthcare Program is a recognized federally qualified health center and provides affordable health services to underserved populations like the LGBT community, regardless of age, race, diagnosis, or lifestyle. Nyla Moon is a community manager focused on transgender outreach and facilitates trainings for medical professionals on gender sensitivity and transgender concerns. Brandy Andrews is a senior outreach specialist and has extensive experience with HIV/AIDS prevention and has worked in the behavioral health field for over 7 years. Lindsay Slay is the Director of Youth and Prevention Services and specializes in clinical work with underserved populations like young men of color and the transgender community affected by HIV/AIDS. Thank you, ladies, for joining us today.
Thanks for having us.
Thank you.
Great, awesome. So I would like to start the show off to talk about the roots of Housing Works. Why was the organization formed and created? And also, I know that there are satellite clinics throughout the city, so we could also let our viewers know where can potential clients get these health services.
Sure. So Housing Works was formed by a group of ACT UP activists who really saw the importance of housing being at the center of healthcare, particularly for people with HIV. So we've really built our mission around ending HIV and homelessness in New York City, and it's grown over the years to involve a lot of other comprehensive services that help support that mission, as well as working with people who have chronic illnesses and doing a lot of HIV prevention work, which is what we do.
Okay, great.
And our sites, so we have 4 different clinics around the city. We have 2 in Manhattan and 2 in Brooklyn. We're based out in East New York, which is a really underserved population, so we're happy to be out there in that community. And each site has a range of additional services like mental health care, substance use counseling, dental. We'll get into all the things we offer.
Right. So why is it important for people, let's say, with HIV and AIDS to have this specialized healthcare? Why is that a crucial part of their life?
Yeah, I think it's really important that people with HIV are able to see qualified doctors that really understand how HIV treatment works, but also to understand how people with HIV still face stigma today. They face a lot of barriers to accessing care. There's a whole host of issues they may be tackling, and when they go to a provider that doesn't have that kind of training, they may be judgmental about their substance use and tell them they can't be seen in the clinic, or not understand the identity of an LGBT person. So I think our healthcare providers and anyone specializing in HIV really has that full range of understanding and can best treat that person.
Great. And why is proactively seeking a healthcare provider important for the LGBT community, especially those living with HIV and AIDS?
Well, I think it's super important because a lot of LGBT folks experience a lot of barriers to healthcare, like Lindsay just stated. I was just at a conference on transgender health, and a lot of providers upstate were talking about that their colleagues were still experiencing a lot of barriers in actually giving trans folk and GNC folk actual services too. So it's very important that we still reach out to these populations that are incredibly underserved, even still in New York City, and provide them care.
Great. So how does Housing Works help determine potential clients' eligibility for healthcare, like let's say a qualified health plan, Medicare or Medicaid? And is there enrollment assistance at your sites?
Okay. There is enrollment assistance at the site. Qualifications vary per person.
Okay.
If they are uninsured, we help them to gain access to insurance and many other things, but it's a case-by-case basis.
Okay. And what about individuals? You know, sometimes we do run into individuals who do not want any kind of government medical assistance. Is there kind of like a payment plan for people who don't have insurance and don't want to sign up for insurance, or those who just aren't eligible?
Yeah, we do have a sliding scale fee at our federally qualified health centers. So that means people who aren't eligible for insurance or don't want it for whatever reason can fill out a form, and they would just pay based on their income. So if they don't have income, that would be nothing, and they would be getting free health care. If they're open to it, we do have health insurance enrollers at all of our clinics, as well as on our team who do more field-based outreach work. We have someone who'll go out and do online enrollment for somebody wherever they're at an event, at a school.
Okay. Okay, great. So let's dive into the healthcare services that Housing Works offers to the community. What are kind of like the primary services or the most popular services that people visit you for?
Okay, I would say the most popular services, if we're going to say popular, that they come to our clinic for would be the top one, primary care, of course.
Okay.
All your primary care needs. Dental care is the second one. Wellness and prevention, and it would be like we have undetectables program for people who are HIV positive to help them remain adherent to taking their medicine and remaining undetectable. We have the PrEP and PEP program as well that people come for under the wellness umbrella. And we'll dive more into that later. Okay. We have Youth and Prevention Services, which is the department that we all work at. And Youth and Prevention Services, if they come in, they can receive an array of services. We have free HIV, Hep C, STI testing. We also offer drop-in center activities in the evening for youth services. We also have career labs and help if they want to, fill out job applications, resume help, join one of our job training programs at Housing Works, which we call JTP. Okay. We also have substance abuse and mental health services, assistance with housing, and we use like a harm reduction model.
Okay, and I've heard
substance abuse.
Okay, and I've heard that term harm reduction model. So for viewers who are unfamiliar with the healthcare lingo, what exactly does that entail?
All right. Well, harm reduction is basically, if I want to put it into layman's terms, it's basically reducing harm. But in that, I would say, I would give an example, like wearing a seatbelt is harm reduction to yourself, correct? Or if someone was addicted to drugs, harm reduction model would help them to make sure they're drinking water, make sure you're eating, make sure you're bathing, in addition to you still doing what you're doing. It's not saying don't do it. How about let's do less of it? It's basically baby stepping your way.
And also kind of like providing more education and
education around
on specific topics. Okay.
Absolutely.
Okay. You also mentioned PEP and PrEP. Let's explain to our viewers the difference, because it could get a little confusing.
PrEP is a prophylactic that helps to prevent the spread of HIV. Okay. It's a pill that you take every day, a daily regimen. You would take it like a vitamin. It's a Truvada, so it's able to be taken with many different other medicines and not being able to, have any complications. The side effects are really, really mild, slim to none. And PEP is a pill that you would have to take if you come in contact or you think you've come in contact with the HIV virus. Within 72 hours, you could come to us, or we'll give you like the information later on PEP. You come to us, take it in 72 hours. And if you come in contact with the virus, it will eliminate it from your system.
Great. Good. Thank you for that. So one of the other programs that Housing Works offers is an adult day healthcare program. So I would like to know who's eligible to participate in that program and what does that really entail?
Yeah, our Adult Day Health Program, or ADHC, is a day program that has traditionally been offered to people who are HIV positive. It now also includes people who are at risk for HIV. And the goal of that program is to engage people through a variety of ways, through their peers, by attending groups on different health-related or mental health-related topics, through one-on-one counseling, and then through just recreational activities. They get 2 hot meals a day.
Wow.
They get a safe space to be, which is really important to a lot of people involved. So we have an ADHD program at our downtown Brooklyn site and also in Manhattan at our Lower East Side site.
Great. And does the organization have an office in the Bronx as well?
We have a health home office in the Bronx, so we don't have a clinic there, but our health home it's a team of case managers who work with people to help reduce the need for ERs and hospitalizations. It's really a team that helps people access health care, address barriers to getting care and being engaged with their provider or specialty providers. So we have health home offices all over the city. They're a really important part of achieving our goals of getting people health care they need.
Great, and that leads us, perfect. That leads me to the next question, which was to talk about the health home care coordination. Why is that important to kind of have an individual service, all their services coordinated? And I think you mentioned that, but can we elaborate a little more about that?
Yeah, it can be really complicated and discouraging to get healthcare. Even we talk among ourselves as providers who do this. We have our own challenges accessing competent healthcare because there are many things that get in the way in terms of insurance challenges, transportation, stigma, like we've mentioned. So somebody who has all these barriers they're facing is going to give up quickly if they're trying to be seen and there's a month wait, or they don't know who they can see and what the coverage is. So a team of people who are experts on that, who can go with them to the appointment, they can sit in on the appointment if they need someone to really advocate for them or help them problem solve their barriers. So it's really essential, and it's a way to keep people out of hospitals and to decrease unnecessary healthcare costs and unpleasant situations for people who have to get emergency care when really all they needed was, a regular doctor.
Gotcha. Yeah. Great. So let's talk about transgender health services. I would like to kind of, within the past 5 years, I feel, there has been more news and the transgender population, the health services that they require, that they acquire, has been kind of like brought into the limelight. So I would like to talk about that, especially to find out if transgender health services are covered under Medicare or Medicaid, and also what critical transgender services are needed for this underserved population.
Yeah, let's get into it. So I want to start by saying that transgender services are life-saving services, and they can definitely improve the quality of life for transgender individuals. So a few years back, New York City and New York State passed laws that allowed transgender individuals to actually get services in the light.
Okay.
Because a few years back, transgender people, when you would get services, doctors had to code it a certain way, and it was a way that you had to work the system.
Right.
And so now a lot of hormonal replacement therapy, surgery, a lot of those services are covered by Medicaid now. So a transgender individual can actually go to her doctor and get prescribed hormones, and she can get gender confirming surgery through her doctor, who will send a referral to NYU or Mount Sinai or Bronx Lebanon, and they will cover the services. And it's really unique because New York City and New York State are some of the first states that actually allow transgender people to get these surgeries, get them covered.
Wow.
And now it's been, I would like to say, a trans renaissance in healthcare because a lot of trans people have been able to fully become who they are,
Right.
and once they have access to care, they don't have to worry about doing survival sex work too, because a lot of trans people do survival sex work not only to, survive because they're discriminated against in housing and employment, but also to save up for their surgeries too. Right. So now that New York State covers it, they have one less thing to worry about. So what we do now is we like to help guide transgender individuals on what they need to do to get it covered. And it's a fairly easy step, and it's a lot of happy trans people out there who live in New York.
It's a great kind of evolution within the LGBT community, and it's incredible. Good. I would also like to kind of leads us to what kind of you know, we hear about a lot of people misinterpreting things regarding the LGBT community. Let's talk about some of the stigmas that affect, you know, the LGBT community, especially the stigma of those individuals living with HIV and AIDS.
So I'm a 90s baby. So I heard of.
I heard.
So back in the day, you know, HIV was a gay disease, right? And the three H's, right? Hemophiliacs, homosexuals, and Haitians. That's what they used to structure HIV as. And a lot of times, like, LGBT folk were automatically assumed to have HIV, and a lot of the stigmas that carried over of being HIV positive also, like, combined with being an LGBT person. And even to this day, right, like, we'll have people who come in and they'll be like, oh, they'll get tested and they're like, oh, I like had sex with a trans person. I'm sure they have HIV, right? And a lot of these assumptions are still carried on, and they definitely need to be dismantled. And there's still a lot of assumptions within the LGBT community as well, too, right? So at Housing Works, we're doing a lot of work through social media and outreach and advocacy to help dismantle these beliefs.
I agree. You know, growing up as a young gay person in the Bronx in New York City, there was always kind of like, you know, there was like an unfortunate perception of AIDS and HIV. And now, you know, fast forward to, you know, 2018, I feel like it's no longer a death sentence. You know, I have friends, people living with it, and they're healthier than me. You know what I mean? And it's incredible. It's incredible to see the difference. And I also think that's due to knowledge being, you know, people being exposed more to information and advocacy. Do you have any other?
Yeah, I wanted to piggyback off of what Nyla said as far as educating the surrounding communities. A lot of people who are not inside the LGBT community are still having these type of stigmas in their minds. Like, you know, we have partnerships with colleges, and we're, you know, trying to, I don't want to say infiltrate, but we're trying to get into the school system so we can start educating from young, so they're aware and they know what PrEP and PEP is. They know, you know, health prevention methods, and they know that, you know, it's not a gay thing, or it's not a trans thing, you know, or PrEP is not a gay program. I'm hearing that a lot, you know. So now I see that they're starting new initiatives for PrEP for women. That's another initiative that I've been seeing. You know, I saw a couple advertisements on the train. I've been out in the community at different various events, letting people know outside of the LGBT community a lot more information about HIV, AIDS, Hep C, and the whole umbrella.
Great. So besides social media, how else do you kind of communicate with the young generation, the young LGBT members? Is it, you know, only through social media? You mentioned you also go to schools and colleges. What's that process like?
Outside of social media is really big. I don't want to like side note it. It's a really big way to connect and engage with a lot of kids. Where are the youth right now? They're online. So that's one of the tools that we use to engage them, and it's a huge tool. And I think it's very important, and I think more organizations should, you know, try that route as well. We advertise on certain dating sites as well, you know, to come and get services or like hotline, you know, if you have questions about different things, different dating apps. We also, when we're at these colleges, we're tabling and we're giving STI testing for free, because a lot of college kids are not getting STI tested, you know, because they're on their parents' insurance, or they want it to be anonymous, or they can't afford to pay for it. So we provide that service and to that population, as well as pre-counseling before they get testing, you know, so giving them more education about that. And we also do a lot of outreach events, a lot of health fairs, where we're, you know, spreading the information, giving people promotional items and things to take with them and read. We also have the website, so you can also go on the website. So we have many different facets of reaching different populations.
So you said at the table, so these, you know, let's say a youth or anyone who wants to get tested in a kind of discreet way, are those services free? Like
Absolutely.
Oh, great.
100% free. And most of them are rapid. You can get your results there. And a couple of them, like the STI testing, we send to the lab and they call you personally with your results. So those services are free.
That's good to know. So now jumping on the other end of the spectrum, what about our older LGBT kind of like our pioneers. What type of services does your organization provide older members of the LGBT community?
Yeah, we definitely serve an aging population at Housing Works as well as youth. A lot of folks are living a really long time with HIV, which is great. And so some of the things at Housing Works, we really have been like kickstarting these sexual health campaigns that are very inclusive of older adults, and they love coming to these workshops. We did a whole like sex dungeon in our site for educational purposes.
Huge turnout.
And people loved it, and they get free sex toys and all that stuff. And so the whole point is we don't want to stigmatize them either or think that they're not at risk. So Housing Works involves a lot of older adults in their ADHD program, as well as the substance use treatment. A lot of our residences are occupied by older adults that have been there for over 10 years. So they're a big part of our community.
Like they say, it's never too old, you're never too old to learn and to be educated and
to be sexual, right?
Exactly. So with your experience within LGBT health, what about some of the specific health disparities that are happening, and how can we, as as a human race, kind of improve and close the gap within the LGBT community with the health disparities happening in the community?
I at Housing Works, I do the gender sensitivity training to all new hires, and I think it's very important to continue educating people who are not LGBT on who LGBT people are is the first step, because a lot of trans people and gender nonconforming people and gay people, they have a lot of barriers to coming into care because they don't know if places are going to be sensitive of their gender identity or their sexuality. And unfortunately, it shouldn't only be Housing Works and a few other organizations that provide LGBT competent care. It should be everywhere. So I think that's very important, that everywhere should get on board with being very sensitive and providing competent care to different communities,
right?
And particularly LGBT communities of color and LGBT undocumented communities as well.
Yeah, and all the data is still showing that young men of color who have sex with men and young trans women of color are disproportionately affected by HIV and have the highest new infection rates. So programs like ours exist where we, all of our outreach centers around reaching that community, creating space that they want to be in, and connecting them to affirming services. So more of that is needed because we have to do that extra work to close that gap. Yeah.
And to piggyback off of what Nyla and Lindsay said, I think it's very important too that organizations not just, hey, you're enrolled, actually walk people through the process, because that's important. Number one, you're facing all these stigmas. You're scared to come into a clinic. Will I be accepted? X, Y, and Z. Then when you get there, it's like, okay, a ton of paperwork. What do I do next?
Exactly.
What's unique and special about Housing Works is that we provide that service of, walking the person through the process, whether you find out that you're positive, whether you're negative. We give you options, and there's a team around you to support and to help you step by step through everything to make sure that you complete it and reach all the goals in health that you would like to reach.
Incredible. Okay, wonderful. Thank you, ladies, so much for your time and the incredible resources and information you provided today. Thank you very much.
Thank you so much. And don't forget to follow us on Facebook, like our page, HWYPS, and follow us on Instagram at HWYPS.
Awesome.
Thanks for having us.
Thank you very much.
Thanks for having
us.
us.
Thank you so much.
Thank you.
Thank you very much. Thank you all for being on CMS You today. We deeply appreciate your time and the healthcare information offered to such a diverse and colorful community that makes our city great. If you or someone you know needs more information regarding LGBT health services or HIV/AIDS supports, resources, or prevention information that is provided in a safe and judgment-free zone, please visit housingworks.org or contact them directly at 347-473-7400. For assistance with health insurance enrollment, contact their healthcare navigators at 929-441-2282. Please also visit outtoenroll.org for more LGBT-friendly resources. There you can find frequently asked questions related to LGBT health and additional information on LGBT supports and services. For national LGBT health news and reports on public efforts pertaining to LGBT and HIV/AIDS wellness, please visit cdc.gov. cms.gov/LGBT health or call the Centers for Disease Control and Prevention directly at 800-232-4636. For worldwide information on HIV/AIDS medicine, advocacy, and resources, please visit aidshealth.org or call 323-860-5200. We hope that today's show has inspired you to either seek or recommend to a friend or family member healthcare services that are quality-driven, supportive, and culturally sensitive. We support Housing Works' mission to close the gap in health disparities for the LGBT community, especially for those living with HIV/AIDS, through advocacy, education, and research. If you'd like more information on your state's marketplace or Medicaid programs, or you'd like to find general health care insurance assistance in your local area, please call 800-318-2596 or visit healthcare.gov and select your state. Remember that health insurance helps protect our loved ones, ourselves, and allows us to get the care we need to stay healthy, regardless of sexual orientation, diagnosis, gender identity, or race. I'm Christopher Semide, and on behalf of the team members from Housing Works and all of us here at CMS, thank you for watching. Until next time, be well.
Medicare will soon be removing Social Security numbers from Medicare cards and mailing new cards that include a new unique Medicare number. We will be mailing new Medicare cards between April 2018 and April 2019 to all 58 million Medicare beneficiaries. Understand that mailing everyone a new card will take some time. Your card might arrive at a different time than your neighbors or your friends. We are removing Social Security numbers from Medicare cards to protect your identity. To make sure you receive your new card, please make sure your mailing address is up to date. If your address needs to be corrected, contact Social Security at ssa.gov/myaccount or calling 1-800-772-1213. Once you get your new card, destroy your old card and start using your new card right away. Beware of anyone who contacts you about your new Medicare card. We will never ask you to give us personal or private information to get your new Medicare number and card. For more information on the card or tips on keeping your Medicare information safe, contact Medicare by calling 1-800-MEDICARE. That's 1-800-633-4227. Or you can visit us on the web at www.cms.gov/Medicare/new-Medicare-card. Thank you.